You want to have a natural birth and avoid a C-section, and you just got diagnosed as high risk. Maybe it's the fact that you're just an older mom, over the age of 35, even 40. Maybe it's that you had previous C-sections before. Or maybe it actually is a risky situation where you need to have a C-section. Whatever it is that has you freaking out right now, I just want to let you know that high risk isn't always what they say it is. In fact, if you go and check out some of my other videos in the Deep Dive Masterclass series, you will find videos on how to assess your risk factors. I also included a little bit about this inside of my little report on assessing risk, which you can get access to through either the Empowered Birth Toolkit or through the book bonuses. Now, all you have to do is go to empoweringmomsbirth.com/toolkit. You put your name and email in. That gives you access to the toolkit itself and all of the book bonuses, including anything else that I add to empowering moms inside of our self-study and do-it-yourself programs. So I will be telling you more about that, but if you want to know the overview of do-it-yourself and self-study and our higher path of premium coaching, all you have to do is go to my website, empoweringmomsbirth.com/start guide. This starter guide is where I would suggest you start if you are brand new to us. First of all, it tells you the difference between natural birth and true natural birth, which is the process that your body is going to do with or without permission. It's also going to tell you about the mistakes that you could be making as a first-time mom, a seasoned mom, or even a VBAC mom. And it's also going to give you additional resources that you're going to want to check out. Here at Empowering Moms, I believe that information needs to be free and accessible. That way you can actually avoid a C-section and not fall into the cesarean traps. And of course, this series is all about the cesarean traps. So if you have been following along, then you already know that we did trap number 1 and trap number 2. There was also an introductory video that I'm going to suggest you check out if you are not familiar with the term cesarean traps. This is going to go into what a cesarean trap is, how to spot it, why it's a problem, and also how to get the most out of these deep dive master classes. So if you are brand new to me and you want to know what the heck this actually is and how it's different from typical childbirth education and why this video is so long, that's going to answer most of your questions. What I'm going to tell you though is to go and check the description of this masterclass. Go into there and find out if there is a transcript available. If there's not a transcript available, there are still a lot of resources that you're going to want to check out, especially if this is your first video that you have found on the Empowered Birth channel. See, here at Empowering Moms, I have one philosophy. Information is free, and I only charge for access to me. And that is because I am committed to you having an empowered birth, whether you work with me or not. Whether you get my book, Your Empowered Birth, which you can see behind me in the background, and also whether you go and check out any of my other videos. All I ask is that if you find value in this video, please pay it forward. Like, share, subscribe to our channel, pass this on, and give this to other moms. Because, you know, there's so many moms in the mom groups that are told you are high risk, you have to have a hospital birth, you can't have a home birth, you have to have a C-section. And you know, this can happen even when you're not actually high risk. So today I'm going to be debunking that myth. I'm also going to be telling you additional resources that you're going to want to check out if you want to go deeper. The deeper you go with empowering moms, the more treasures you will uncover. The other thing you need to know about these master classes is that you have options within them. You're going to notice throughout this video that I have headlines, and the dark blue headlines basically tell you the overview of the different topics and what's coming up so that you kind of get the gist of it. You can skip around, but I do recommend that you watch this video at least once. The reason for that is because of the rule of 3. You watch something that's brand new to you the first time, and there's so much that is coming through. You may not get it all. However, you're going to have more of an idea of where to go next. The second time you watch the video, you kind of know what's coming up. You know what sections were really relevant to you. You're like, I know this. I don't need to watch this again. And you jump around. But now you kind of have those aha moments. You can go back and be like, wait a minute, that section here in the video, that segment is what I really want to get integrated into what I was thinking about before. Like, what did she say about that? Tell me more about that. And then you can go and you can find those little ahas. The third time you watch it, that is when you can implement. So if you are a serious student, even at the do-it-yourself level, you can get an empowered birth. You do not have to go into self-study and you do not have to go into premium coaching. And at the same time, if you want an accelerated path and you like more structure and you really appreciate having additional tools and support, then the self-study path and the premium coaching path are available to you. And again, if you want to know more about that, you can go and check out the introductory video that I did in this series, which is inside of the Cesarean Traps playlist. You can also go to my website, empoweringmomsbirth.com/start guide, and that will give you the overview. Okay, so now we're just going to dive in because, I've done longer versions of these master classes and built that foundation. So you're going to want to check the playlists when I reference other things in the video, or check the transcript if that is already put into the description. If it's not, then typically the master classes that I reference, unless otherwise stated, are inside of the deep dive playlists. There are 2 right now, currently. There's season 1 of the Empowered Birth series, which is all on the 26 things that you need to know if this is your first time planning a natural birth, which is our essential tips series. This is the first one. I'm going to be referencing some master classes within this class that are going to directly tie into some of those previous videos. The other one is the natural birth traps, and this is where the cesarean traps come into play. So the natural birth traps hit the foundation, and you got 20 traps that you want to avoid if this is your first time planning a natural birth. At the same time, you're going to also need to know the cesarean traps because there's a whole other section to how these natural birth traps show up when it comes to pushing you into an unnecessary C-section. And as I mentioned, today we're going all into the high risk label. So what I'm going to do is I'm going to tell you a story of how this almost risked me out of having my natural birth and tricked me into a C-section, and how I avoided it. You're also going to learn how a lot of my clients who have wanted to have a VBAC have been able to boost their confidence even when they have been told that they are high risk. And then I'm also going to tell you about things to consider when it comes to actually realizing you are high risk and you do need to have a C-section, because there are sometimes complications that come up in pregnancy that really do require you to have a C-section. And in that case, you deserve to plan the most empowered C-section, and you deserve to have it be a beautiful and empowering experience, because every birth can and should be a beautiful and empowering experience. And when I'm working with my clients one-to-one or within a group setting, what we're really looking at is not natural birth or bust. What we're looking at is, do you actually need a C-section? Because our C-section rates can go anywhere from 30% all the way to 90%, depending on your region, depending on your hospital, and depending on who you hire. Go check out some of my other videos where I talk about this in the Essential Tips series on how to hire a care provider for a natural birth. Because the fact is that you need to have that baseline first. You can't just go and hire any doctor or any midwife and expect to avoid a C-section. It doesn't work that way. The way that our medical system is really set up kind of leads to moms getting a C-section because it's get them in, get them out. And if you aren't aware of that and you fall into the fear traps, especially if you're labeled high risk, what this does is then you try to justify that C-section, or other people try to justify that C-section. You know, the healthy baby is all that matters, or be grateful it wasn't worse, or be grateful that you avoided the C-section even though you had a lot of trauma. You know, you deserve to have the best empowered birth experience possible, and you deserve to know whether that C-section is actually necessary or whether you're about to fall into the cesarean traps. So now today I'm going to share a story with you about how this almost manifested with me getting a C-section with my first baby. Now, if you want the full story, then you want to go and check out my book, Your Empowered Birth. I do have a playlist available so you can listen to the book. And if you do want to be able to highlight things, mark up the pages, reference certain parts of the book, then I do have a paperback version on Amazon, and I also have Amazon Kindle. So you can go to the website and you can check it out. You can check me out on Goodreads. Whatever you do, if you're going to just listen to the book, if you're going to actually buy a copy, I would really appreciate it if you left a review. And how I want that done is basically tell me where you were at before you picked up the book or listened to the book. Tell me how you were afraid of birth or how other people had told you you couldn't do it. And then tell me what insight came up, because that is going to help a lot more moms to understand what's in the book. It's going to also give them the aha moments that you came up with, because a drop in the ocean creates ripples, and many ripples create waves, and enough waves can change the tide. So again, I have no attachment to whether you get this book or not. And I have no attachment to whether you go and get any of my programs. I do have something that I will be talking about later into this masterclass. And I have no attachment whether you actually sign up as a client, because what I'm committed to is helping you avoid a C-section just because you have been told that you're high risk, and to make a conscious decision to have the most empowered C-section possible if you determine that actually you are high risk and you need to have that C-section. See, when I was a first-time mom, I knew right off the bat that I didn't want a C-section, which is completely the opposite of what I said back in college, by the way. Back in college, I had been sort of thinking, you know, natural birth is really traumatic. I don't really want to do that. I don't want to be in pain for 3 days on end. I don't want the epidural. And I definitely don't want all those needles. I don't want to tear end to end. Just give me a C-section, knock me out for it, and then give me a tummy tuck. If I ever get pregnant, that's what I want. And I even had listened in my anthropology class about how a woman had described her C-section as being disconnected from her body. And I said, well, I don't understand why that's not like a good thing, because why would you want to go through that? I later changed my tune, because as I got older and as I recognized that a C-section would mean major abdominal surgery and it would actually be more painful than having a natural birth, and I'd have to be in the hospital for that, and I'd still have to get a whole bunch of needles, and then I'd also be cut open, I realized I didn't want that. And so I got pregnant with my first baby when I was 26, almost 27 years old. And I went into my first appointment to an OB, and they're like, oh, we do our own epidurals here, without actually asking me if I wanted an epidural. And all I knew was that I didn't want to be in the hospital. I didn't want to risk having a C-section. I had also started to watch other things on like documentaries, and I'd seen A Baby Story enough times to realize it's like all these moms keep getting C-sections, and I really don't want that. I don't want that. And I'd also learned about orgasmic birth, which I was like, I could actually have less pain in my birth. I could actually have it be ecstatic. And I was curious about water birth. So when it came time for me to really decide what I wanted to do, I said I'm having a home birth. And the original reason was because I just wanted to avoid that C-section. Now, we flash forward to 35 weeks, and I am now considered high risk. I didn't plan to be high risk. And the reason they said I was high risk was because they had done a growth scan. It was badly done. Go check out some of my other videos on growth scans if you want to know more. They are in the Natural Birth Trap series, and I also talk about this inside of my book in chapter 3, A Harsh Lesson. But what I needed to understand is that there's a difference between actually being high risk and might possibly maybe happens that they were doing in the medical system. So there's a complication, a variation, and a deviation. And I did do a report on that. It is a bonus inside of your Empowered Birth. It is also inside both the workshop and inside of the Empowered Birth Toolkit. So again, all you have to do to get access to that is go to empoweringmomsbirth.com/toolkit. Then that's going to give you access to the Google Drive. You click on the folder that says Empowered Birth Wisdom. And then in there, there is another folder that says your Empowered Birth book bonuses, and it's nestled right in there. It is the 5-step decision-making framework, and it talks all about variations and deviations and complications. You can also just go check out my video that I did in the Deep Dive Masterclass Essential Tips series on assessing risk, because I did cover that as well. Now, the thing about the toolkit is there's also a workbook, and this workbook allows you to then assess whether this is a complication, a deviation, a variation, and then you can be like, okay, here's my plan for each of these things. Then you can write it out, because it's not enough to just have the information. You need to be able to filter it through your lens and come to your birth from a place of power instead of a place of fear. And I have a whole bunch of resources on that as well, because getting past fear is really how I was able to avoid the C-section in the first place. So they had told me at my 35-week appointment that I was measuring small, and then I didn't hear from them for about 3.5 days. And then when I heard from the midwife again, she said, I'm sorry, your baby is not growing properly. He may have intrauterine growth restriction. And then that is going to basically mean that he is going to need to come out by C-section. You're possibly going to need to be induced. Now, I did do a little bit of a longer deep dive on the topic of small baby and intrauterine growth restriction and small for gestational age and the difference between that. So you will want to check out that video within the Cesarean Trap series on small babies. So once I realized that I was facing a C-section, this is when I started to panic, because I hadn't read the C-section chapters. I hadn't wanted to even explore that. I'm like, no, I'm having home birth, so why do I even have to worry about that? I mean, the only way I would need a C-section is if there was a serious complication, in which case they'd knock me out for it. I wouldn't have to be awake. I wouldn't have to deal with it. And that is very slim chance of happening because I'm healthy. And then suddenly being faced with this possibility that I'd have to have a planned cesarean, and I didn't want it. Now, my midwife tried to get me to be okay with this by talking to another client who had been very, very crunchy mama. It was her first and only baby, and she was much older, and she had ended up having IUGR, and so she went for the C-section. And I was not comfortable. Even as I was talking to her and she was reassuring me that it wasn't really that bad, I'm like, yeah, but it really doesn't feel right to me. I don't want it. I understand that it's not that bad, according to you. I understand that, but I still don't want it. Like, I just don't want it. And so I continued to go for the non-stress tests because I wanted to determine that my baby was still okay. As long as he was okay, I wasn't going to induce and I wasn't going to have a C-section. Now, this is really hard for a lot of moms because when you're told you're high risk and you have a care provider who constantly tells you that your baby is not going to tolerate labor well, that does undermine your confidence. That does scare you. If they keep saying that you're going to have a complication and you need to just have the C-section, that is a real thing. It feels real in the moment. At the same time, I knew enough because I had my skills for critical thinking and I've had a lot of trauma in my life. So I was able to be like, well, this is a could, might, possibly, maybe happen. And I do have a whole framework around resetting your mindset for an empowered birth and helping you get past fear. So you're going to want to check out both the Reset Your Mindset for Empowered Birth mini challenge, which you can go into the playlist on my YouTube channel and it's right in there. I also have it linked within my starter guide. So empoweringmomsbirth.com/start guide. It is the first step of empowered birth education. And you don't even have to put in a name and email. It's right there on YouTube for you. The second step, of course, is going through my book, Your Empowered Birth. And then the third is the Empowered Birth Workshop called Your Empowered Birth Workshop. And inside of this workshop is actually the first module of getting past fear. Now, this module is so important that I wanted to make sure that it was still accessible, even if you didn't go through the whole course right away. Even though the workshop is free and all you have to do is put in your name and email and go through it, if you just wanted to have the part on getting past your fear, if that was what was keeping you stuck, then that is inside of the Empowered Birth Toolkit. So again, you go to my website, empoweringmomsbirth.com/start guide, and that's going to give you the overview of more of what you need to be working on through the empowered birth method, because we aim for a true natural birth, and then we pull back only as much as needed. And that means that the cesarean is your last resort. It is your backup plan. You have it in the background. You're like, okay, if I had to have a C-section, I'm going to make it the most beautiful and empowering experience possible. And we're not going to focus on that. So in the end, it turned out that I didn't have an IUGR baby. I had a small for gestational age baby. And because of the fact that I had been so strong in my convictions that I wasn't going to have a C-section unless I could actually see the red flags happening, and I had drawn my hard lines in the sand of when I would actually agree to a C-section, that allowed me to avoid it. My friends were not so lucky. There were a lot of moms inside of my community, even within my midwife practice, who did get manipulated out of their natural birth and did end up getting a C-section. One of them being Christine. Now, hers wasn't because she was high risk. Hers was because she was going past 42 weeks, which automatically then would put her at risk for having a stillbirth. But they didn't tell her the numbers. And because they didn't tell her the numbers, she freaked out and she thought she needed to induce. And she also didn't want to lose her midwife. There's a lot of problems that happen when you get diagnosed high risk, is that some midwives just can't support you anymore. Some OBs automatically just look at that label and then they see you as a disaster waiting to happen, a time bomb, a ticking time bomb. And then they inform that practice. However, you can also do what Jenny did. And Jenny is the high-risk mom. She's the epitome of the high-risk mom. Chronic high blood pressure, previous history of preeclampsia, gestational diabetes, and she was 41 years old. So she was actually technically high risk in a lot of ways. Having chronic high blood pressure is a serious thing. And we also knew, because she had preeclampsia with her first baby, that there was a very real possibility that she would need to have another C-section. There was also a very real possibility that she would need to have an induction. And at the same time, Jenny was determined to do her best to avoid that situation. Jenny had a 15% chance of success for a VBAC, according to the VBAC calculator. Now, if you know the story of Jenny and her amazing unassisted vaginal birth after cesarean in the hospital, then you already know. She was labeled high risk, and at the same time, that wasn't true for her. And because she was able to focus on what was true for her, she was able to then avoid the induction and the C-section. In fact, at one point during her pregnancy, near the end, she had recognized that she had a little bit higher blood pressure than normal, and she was worried about that. She wanted to go to the hospital and get checked out. At the same time, she was like, but I don't want them to be pressuring me into an induction. So what I asked her is like, okay, Jenny, what is it that you really want to know? And this is what I suggest you do, is that if you have been labeled high risk, you need to know three things. First of all, you need to know whether you're actually high risk. Like, is this a real complication? Is this just a variation where might possibly maybe happen? Or is it a deviation where a red flag could come up in the future? Because there is a difference to the level of risk. And again, if you want to know more about that, go check out the Essential Tips series, Birth Advocacy 101, when I talk about how to assess risk, because that's going to give you more. I can't get into this masterclass. It would be like more than 2 hours long if I told you every single nuance on how to avoid a C-section for high risk. If you have any questions, you can always put them inside of the comments and I will get back to you. Now, if it's urgent, if this is something that is time sensitive, then your path is to email the team, hello@empoweringmomsbirth.com, and we will get back to you within 3 to 5 business days. We don't work on Friday through Sunday. So it's Monday through Thursday that we will be answering messages. And if we don't see it before that, then it may take a little bit longer. If, however, you are already part of our Empowered Mom community, which is through the community newsletter, then your path is a little bit different. All you have to do is hit reply to any one of our weekly newsletters, and then we will get back to you within 1 to 2 business days. We may even help you out on the weekends if you are a self-study VIP. And finally, the last path, if you are already one of our premium coaching clients, then you have additional paths to us. You may have access to our WhatsApp group. You may have access to me personally. Depending on the level that you're at, you may be able to just ask me a question and I can get back to you within like the hour. So the thing about empowering moms, again, is information is free. And I charge for access to me. And the first level of entry, of course, is putting your name and email in and subscribing to the weekly newsletter so that you can get your Empowered Mom Magic and Empowered Birth Wisdom. I also encourage you to like, share, subscribe to our channel, pay it forward, pass it on, share the newsletters even with other moms that could use it, just forward it to them, and then encourage them to join the newsletter as well. Because I'm really building a community. I'm building a movement here. The Empowered Birth movement is all about basically allowing every mom to have the beautiful birth experience that she deserves. And you don't deserve to be tricked into a C-section or manipulated out of the birth plan that you want to have just because you've been given that high risk label. So you assess where you're at on the scale of risk, first of all. And then the second thing that you need to do is you need to get past the fears that are coming up for you. Because there may be some real risks that happen, even if you have just a variation, a complication, or a deviation. And you need to first get past your fear and recognize, okay, cesarean could be on the table. How can I make that a beautiful and empowering experience, first of all? You don't stay there, though. You don't stay in being okay with having a C-section. You simply need to have that as your backup plan. This is how Jenny did it. She had it as no longer a frantic, frightening thing that she was trying to avoid, but instead something that she could call in if she needed it. And she said that the power of the backup plan was really that she knew that no matter what happened, she'd be okay. No matter what actually happened during her birth, she had her plan. She knew that she would be okay, even if she ended up having another C-section, because it would be her choice and because she would go into it knowing that she'd done everything already possible to avoid it. And this just happened to be her path. That's ultimately what I want for you. I don't want you to just avoid a C-section just to say that you had a natural birth. Because if that natural birth is traumatic or something really bad happens during it, then it wasn't really the path that you needed to take. And you do not need to take other people's advice on what you should do. You are your own best expert. So I want you to be able to trust yourself. There are a lot of tools inside of the Empowered Birth Toolkit, and there's a lot of support here at Empowering Moms. All you have to do is take action and you can go and get that help. There's also resources that you can check out. I have lots of videos on assessing risk. I have lots of videos on getting past fear. And I have lots of videos and mini guides on all the things that you need to know about basically advocating for yourself. That's where my strength lies, is in getting past fear, advocating for yourself, and being able to actually sort through all of that information that comes at you. Because if you go into the mom groups and you say that you're high risk, what's going to happen is that if you have not gotten past your fears, when they spam you with all of those links and resources, there's going to be some stuff in there that's going to scare the crap out of you. Or some labor and delivery nurse who's only ever seen pathology in her birth community is going to tell you that you should just listen to your doctor and plan a C-section, and there's not going to be a discussion. Or there's going to be that mom that was traumatized and said, you know, I wish I had had a C-section because this, and this happened. But they don't have the full story. They don't understand that they fell into some natural birth traps, and that's why it happened. Or you have the mom who had the C-section just like it wasn't a big deal. And you don't necessarily know that it was a big deal or not because they can be gaslighting themselves. Now, I can see this. The more I get into a conversation with someone, or the more I see how they're writing something, I can see that actually they're not as okay with it as they think they are because of the triggers that come up. Whenever I say something in a certain way, and suddenly I get attacked, and I'm like, oh, wow, yeah, they have not been able to resolve their trauma. And our entire birth culture has been basically immersed in trauma. So you need to understand that. Finally, the third thing that you need to understand to apply the empowered birth method in this case is that you need to be able to go into this and make your plans. Once you've gotten past your fears and you are able to sift through the information, you make your plans based on the information that you gather. So you are now going to look into the complication or the high risk label of what they're actually saying. And what you need to do is get the numbers. You don't want to just hear about how it increases or decreases after a certain point. You don't want to hear about all the could, might, possibly, maybe happen disaster stories that can happen. Yeah, they could. What's the actual percentage of it? And what could you do to mitigate that risk? See, Jenny did a lot of research when it came to being labeled high risk. She knew that she had chronic high blood pressure. So she did everything in her power during her pregnancy to mitigate that risk. She was monitoring her blood pressure. She was changing her diet around to reflect what she wanted. She was also making sure that she was not having a lot of stress, and she was paying attention. She was paying attention to her numbers. She wanted to know what numbers would be too high, where she'd be like, this is where I would draw the line. She made that decision, not the doctor. She made the decision. Where is that pink line in the sand where you're like, okay, I may need to change something. I may need to start looking at my backup plans versus the red line that's like, red flag, we need to act now. The more you can get those pink flags and see them ahead of time, the better off you're going to be. Now, this is the same thing if you have gestational diabetes or even type 1 diabetes. Claire Sherman is a case of a mom who wanted to have a home birth after cesarean. She had type 1 diabetes, and she was able to assess her risks. When Claire came to us, Jenny was already on her path to her empowered birth. And so Claire witnessed Jenny, the epitome of high-risk mom, go on to have that unassisted vaginal birth in the hospital. And then she herself got pregnant again. And then she was able to take what Jenny had taught already and then apply it to her own situation. So in Jenny's case, Jenny had gestational diabetes. And she's like, well, Claire, you already have type 1. So the most challenging thing for moms with gestational diabetes is knowing the numbers. You, having already lived with this chronic condition, know how to assess the risks. You know how your numbers actually pan out. You know how to do all that. She's like, yeah, I do. It's like, okay, so you know how to manage the condition. So now the next step is to go and get a book on the real foods for gestational diabetes. And there's a course that she also recommended, Lily Nichols. So she had basically said, go and get this course. So Claire did that. And then Claire also did another thing that she didn't do with her first pregnancy, is that she only hired a midwife this time. Because the last time she said, well, I'm high risk, so I should have the best of both worlds. I'm going to hire a midwife and I'm going to hire an OB. But every time the midwife hyped her up, the OB undermined her confidence and scared her and talked her right into an induction, and then that turned into a C-section. Whereas the midwife had been perfectly happy to support Claire at home, Claire ended up having her confidences chipped away at. That is why you need to have the right care provider. Because if they continue to chip away at you and you don't have the information and you haven't worked past your fear and you don't have anybody else in your corner to support you in the kind of birth that you want to have, then what happens is that you end up coming to this impasse where you're like, I don't know what to do. I should trust the expert. Even though my gut tells me not to, I should trust the expert. And this is where I fell into the trap of agreeing to a hospital birth, even though I knew that it wasn't right for me. Thankfully, I was able to avoid the C-section. At the same time, I had been scared. I had been told that I was high risk. I was told that my baby wasn't going to grow properly. Now, let's discuss, though, if you are high risk, because there are certain cases where you do need to plan a C-section. One of them is placenta accreta. It's very serious. If there is a placenta embedded into uterine tissue, then that is going to cause bleeding. That is one of the times where you're going to need to think very carefully about the risks of C-section versus the risks of going into labor naturally. There are other things that are not really needing to have a planned C-section. However, due to the way that the medical system wants to just control everything, they make it sound like it's dangerous. And then they also won't support the kind of birth you want to have. I will be going into those within the Cesarean Trap series. One of them is twins, one of them is breech. One of them is also a VBAC, because, you know, there's some hospitals that say we don't do VBAC after X number of C-sections. Again, we aim for a true natural birth, and then we pull back only as much as needed. So again, to recap what you really need to understand about applying the empowered birth method to the high-risk label is that you need to know, is this a complication, a deviation, or a variation, first of all? Second, you need to get past your fear. You need to be able to see things clearly so that when you're sifting through the data, you're not worrying about all those worst case scenarios. You're really looking at, well, what are the numbers? Can this possibly happen? And how do I mitigate that risk? And finally, you create your plans around it. So you look at all those things that kind of scare you, like in Jenny's case, postpartum preeclampsia or even regular preeclampsia. That was a very real threat to her. And she needed to plan around that. And that is why she ended up changing her diet. She looked into how to lower her blood pressure. She looked into how to prevent preeclampsia from happening early in her pregnancy. And she really did a lot more research. There's a lot of doctors that they're like, well, there's no evidence to say that you can actually prevent this. But you also have to look at the studies that are being done. They are usually controlled. They are usually heavily medicalized. And they typically wouldn't do a study like that because it's just not ethical to have a woman who has a risk of preeclampsia not get any treatment whatsoever versus getting a holistic treatment versus getting all of the things to help things along. And it's not lucrative for the medical system to have moms not take those medications. It's a business. You have to look at things clearly. You have to see that this is a business. So, yeah, there's not a lot of studies about preeclampsia, and there's not a lot of studies about other high risk complications. However, they do exist. There are some. And what I would suggest that you do as you're making your plan is to go into mom groups that are more holistic, go into free birth groups. Find those moms that had those high risk complications because they do exist and still manage to birth naturally because it does happen. Because when you think about it, if you go into labor and you can't get to the hospital in time, you don't want to be freaking out and being like, yeah, but I'm high risk and there's no doctor. And oh my gosh, because if you panic, it's going to be more painful. You could possibly cause complications because baby's not getting enough oxygen through the blood in the cord. And then it's a self-fulfilling prophecy. And you really don't want that. So, recognizing when you're making your plans, you need to take from both sides. You need to look at the medical side and you need to look at the holistic side. And then you need to look at all of the different complications, the likelihood of them actually happening, then the likelihood of it happening in your case, and then being like, okay, if this thing happens though, how could I be okay with it? How could I make it a better experience? If this was an inevitable outcome, where I was going to end up having preeclampsia, no matter what I do, this is what I would choose. If this was an inevitable outcome where I would have placenta accreta, this is what I would want to do. Because you can't just go by one size fits all protocol. It doesn't work. It's not empowering to do that. Instead, you need to think about what you would do, what you would want. How do you want to be supported? And again, within your Empowered Birth Workshop and the Empowered Birth Toolkit, I do have workbooks for you to go through and ask those questions so you can go deeper than what's in this video. Again, this is the do-it-yourself path. So you can take any one of these master classes, you can piece them together with others, and you can create your own course out of that. You can even form your own questions. And hey, if you want to share your questions of what you asked and tell me a little bit about how it helped you, I would love that because then we're building courses together. I will absolutely credit you and I will absolutely amplify you. And if you happen to be a birth worker and you're watching, then it's going to take all of us. So we need to be sharing our resources in order to turn this around. The other side of do it yourself, of course, is that if you want something with more structure, the very last part of do it yourself is to get that Empowered Birth Toolkit and subscribe to our Empowered Mom newsletter. This is going to give you more details on what you need to be looking for. I give those extra aha moments. I have a theme every single week. I tell you what's also coming up in the community, what's coming up with my Empowered Mom circle of basically people in my network who maybe have a course available, maybe they are doing an interview with me, maybe they have something on offer. I mean, there's so many ways that I use this newsletter to basically tell you what's going on in the community. And the reason for that is because I own the newsletter itself. I'm not having to worry about algorithm changes or platform changes. You will always be able to get access to the pinnacle of new information through the Empowered Mom newsletter. I will tell you about my 3 paths within there. I will tell you when things are changing, and I will give you Empowered Mom magic. So you can also apply the Empowered Birth method to other areas of your motherhood. Because whether you're birthing a baby, birthing a business or a creative project, or birthing a movement or a new version of yourself, Empowering Moms is here to guide you. So what you really need to understand, as I said, is that high risk does not necessarily mean that you have to have a C-section. You can go into this being like, you know what, that could be on the table and I'm going to make it a beautiful and empowering experience, but I'm not going to focus on it. That's not what's true for me. Until it's true for me, I'm not going that direction. You can have your cesarean backup plan. And if you go through the Write Your Empowered Birth Plan mini challenge, which you can check in my playlist on the YouTube channel, then you'll be able to get the overview of how to create that backup plan. So now that you understand about how to basically assess whether you're high risk or not and avoid that cesarean trap, and you know that they basically undermine your confidence by telling you you're high risk and then you get scared out of it, we are now at the end of this masterclass. And if you found value in it, I would just like to invite you to like, share, subscribe to our channel, pay it forward, pass it on. If you are curious about anything that I mentioned, either the self-study path, the self-study VIP path, or the premium coaching, I just want to remind you all of that information is available if you go to empoweringmomsbirth.com/start guide. That will give you the overview of everything you need to know to get started on your empowered birth journey. Whether you continue to do the do-it-yourself path and take every single one of these master classes, or you choose to go with a little bit more structure, or you ask for that direct help, I want you to have an empowered birth. You deserve it. You deserve to decide whether or not a C-section is right for you. And if it is, you deserve to have that be a beautiful and empowering experience that you chose and you have no regrets. At the same time, there are a lot of moms out there that get tricked out of their natural births. They get tricked into having a C-section. And when you have one cesarean, you are automatically a VBAC mom. This then poses more challenges when you attempt to have a natural birth the next time. And if you want to know what those challenges are, I have laid some of them out inside of the starter guide. So you can just go to empoweringmomsbirth.com/start guide and check out the VBAC mom section if you have already had a previous C-section. If you have not, if you're a seasoned mom or a first-time mom, then you'll want to check out the information in that section. And finally, if you want to go deeper, the deeper you go with empowering moms, the more treasures you'll uncover. So check the description of this video, and that's going to give you the relevant links to the starter guide. There may be a transcript available. If it's not, it's coming. Okay, it is coming. And at the same time, if you have any questions or you're like, hey, what was that resource? Where's the link to that you mentioned? Just put it in the comments and I will drop that link for you, or one of my team members will drop that link for you, one of my content queens, because I'm committed to you having an empowered birth, whether you work with me or not, whether you get my courses or my books or self-study. I believe that every birth can and should be a beautiful and empowering experience. So if you found value in this, please like, share, subscribe to our channel, pay it forward, pass this on to other moms, because a drop in the ocean creates ripples. Many ripples create waves, and enough waves can change the tide. And here at Empowering Moms, I'm all about changing the tide, because when you have an empowered birth, you're an empowered mom for life, and no one can take your power away from you again. So that's pretty much all I have for you today. Thank you so much for watching. Next week, we are going to go into one of those variations I mentioned, which technically could also be a deviation if there was additional complications. But we're going to be addressing twins. Do you actually have to have a C-section for twins? And you're going to be surprised to learn that actually there's a lot of moms out there that have birthed twins naturally, even at home. So I'm going to be giving you some stories. I'm going to be giving you some tips on how to apply the empowered birth method and how to assess risks and how to basically plan your beautiful and empowered twin birth. So stay tuned for that. And if you want to also check out some of the other master classes in this series, we have the Cesarean Traps. This is season 3. So just go and check out the Cesarean Traps playlist for previous episodes. You can also check out the first episode, the introduction, if you are not familiar with the Cesarean Traps and you want to know more about what that looks like. I also go into the resources that you're going to want to check out, how to get the most out of these master classes. It's all in there. And then if you want the overview of the Cesarean Traps, the next video in that series is the 21 Cesarean Traps. So you'll be able to see what's coming up next. I also have a guide on my website, so you can go and check that out as well. So thank you so much for watching. Have a happy, empowered birth journey, and I will see you next week. Namaste.